Okay, welcome back, everyone. And for those of you who just joined, welcome to 2022, the Mental Health Festival. My name is Linda, and here at Intellect, we are on a mission to make mental health care and well-being support accessible for everyone. In this session, we'll dive into a topic that's tackled by one of our world's top universities, holistic mental well-being, designing a psychologically informed HR strategy. But first, let's address what inspired today's session. Let's take a look. Awesome. So, how does a leading university address holistic well-being? In this session, Dr. Andrew Tay will share a novel mental health framework used in the National University of Singapore. Beyond the workplace, Andrew will also cover NUS's Are You OK campaign and how the next generation approaches mental health. Okay, please welcome Andrew, Head of Director, Office of the President of NUS. Andrew is a medical doctor with experience working in the employee benefits, health, and well-being space in the technology and pharmaceutical industries. And understanding these complexities of mental health, Andrew really focuses on delivering a well-being agenda that champions the mental health narrative among the university community. One last thing to the audience before I hand it over to you, Andrew. While you're all watching, we have quite a big group here today. You have 3 ways to interact with Andrew as he speaks. Number 1, you can use the reactions below to just send like a quick instant reaction, a thumbs up or something, a wow, a laughing face, if there are any jokes. We would also encourage you to jot down any thoughts or comments in the comment section to your right. And lastly, most importantly, please use the Q&A section on your right throughout the whole session. So just jot down any questions you might have, you might want to ask Andrew, and then he can address those questions at the Q&A section at the end. Okay, enough from my side. Andrew, over to you.
Right. Thank you, Linda, for actually the generous XP introduction. Wow, the first chat that actually came in already. Does anyone want to share with Dr. Andrew the NUS Plant Killer Club idea? I have no idea what that really is, but thank you actually for putting that bit of joke over there. Now, there's a little bit of introduction in of me already. So, medical doctor by training, went to occupational health, and then into this space known as the health and well-being, followed by the COVID, which then amplify the need of health and well-being. But my expertise is more in the area of what is corporate mental health and well-being rather than individual health and well-being. And I'm going to share a little bit of my experience in that space. So let's talk a little bit about NUS health and well-being, because the idea of health and well-being, we know health, we can identify diabetes, cholesterol, hypertension, we monitor them, we know what is the outcome. But when we talk about well-being or mental health per se, then people start to think like, okay, how do you measure that? How do you screen for that? It sounds a bit woolly from a definition perspective. And when you set up an office of the health and well-being, how does that actually look like? What does that actually mean? And what is the work that we do? So health and well-being is not a new thing. It's been around for a long time. Johnson & Johnson is the forefront in this space of health and well-being. They have a health and well-being center of excellence. And as early as the World War II, Robert Wood Johnson, who was a former chairman, right, of the member of the founding company, already started saying or rather putting up commitments regarding taking care of the health and well-being of their employees, as highlighted below. That we must support the health and well-being of our employees and help them fulfill their family and other personal responsibilities. And they went on to publish a lot of papers pertaining to corporate health and well-being. And the model is one that is quite mature. And they all started with a bit of occupational health system and having a bit of full-time occupational health practitioners specializing in occupational medicine. When subsequently you see that GlaxoSmithKline, Procter & Gamble, Unilever, Shell, they all went on to start off their health and well-being landscape. You don't see any tech companies at this point in time, right? But later on, you see that they'll start to catch up also. And Health and Wellbeing Office of the President was then started in the midst of the pandemic in November 2020. And then when I went into the LinkedIn marketplace to start hiring for psychologists, consulting psychologists, organizational psychologists in the marketplace, I realized that I am competing with the tech companies and many other companies looking also for similar kind of talents in the marketplace. So you can see that health and wellbeing is a legit business. Moving forward in 2020, these are some of the new titles that have been generated in the past 1 year, and this is insights from LinkedIn. And you can see the wellbeing titles increasingly being kind of like advertised on their platform. So what this actually says is that companies, including the tech companies right now, are embarking on this importance or on this journey of placing importance in employee health and well-being. So what about the Office of the President Health and Wellbeing Unit? What do we do? Well, we care for 13,000 staff, 40,000 students across more than 115 departments in one country. So it is very, very a big scope for us to actually do that. There are a lot of people who may ask also, why don't you put it the health and wellbeing unit under HR? Why don't you put it under health and safety? Why is it that we put it under Office of the President, which is equivalent to the CEO office? Well, I don't think it is the context of today's session to talk about that, but we can have a bit of coffee chat and talk about the pros and cons of each kind of a setup. Moving on, whenever you set up a health and wellbeing office, you always need to start off with a mission, and it is a simple task for us to do because we just adapt it from the WHO mental health and wellbeing definition, which is to facilitate the complete state of physical, mental, and social well-being. We realize our own potential, cope with the stresses of life, work productively, and make meaningful contributions. The last part is very important. I mean, you can be healthy, you can have everything intact, but if life is not meaningful to you, well-being is not there. But you can be less able, but on the other hand, if your life is meaningful, then well-being is there. But because health and well-being is so big, you do need to prioritize. So we, at this point of time, we prioritize mental well-being as our first and foremost kind of agenda in our strategy. This is how we set up our team. Relatively huge team at this point of time. Remember that we set up our team only in November 2020, and then by the end of this year, we're looking to fill up approximately 62 headcounts. You can see that there are three major pillars: program management that talks about training, development of the training in-house, and we have the clinical services that provide operational services and individual therapies for both staff and students. And then we also have the special projects that do a bit of research and also look at some of the programs that have no playbook, that are at the frontier of mental health, corporate mental health. So things like respondent care, restorative justice, these are some of the things that we might have heard of it before, but what does that mean from a workflow perspective? So this is something that my team in the special projects are actually working on. We'll be happy to share what we are working on in due time when given the opportunities and when the programs have matured. So let's talk about the NUS community. How are they like? When we take a look at the students, and we can see that in the 5-year comparisons of the data points, the number of intake, which is the number of students coming in for the first encounter with our counselors, have increased year on year. And when you compare to that of, say, for example, 3 years ago, it's nearly doubled. And then the number of walk-ins have also increased year on year. And you can see that in the year 2021, last year, 688 compared to 5 years ago. So again, nearly double in the number of people seeking help in distress. And we need to understand that these are our sons and daughters. And in 1 or 2 years, they will be joining your workforce. So this is the Gen Z people. They are ready to go into the workforce, but they bring with them a certain culture, which is they dare to step out and seek help. So are your companies actually ready to have accommodate this group of Gen Z people to be your colleagues, and also providing the kind of access so that you can unlock their performance at the end of the day, and they can be their best selves and thrive? We also realize that each of these individuals that come to seek help, they also require longer support. So which means their follow-up takes a bit longer. They need more number of sessions so as to reach their therapeutic outcome that they need to. So this is something that we realize and we've seen in terms of trend. So what are the main reasons for them coming to us? You can see, as highlighted in red, that personal concerns of self-image being one of the major cause of them coming, feeling distressed and coming to seek help and to help orientate themselves. So you can see that in this age of social media, it is painting a what idea of what a person should look like, how a person should behave, and does this actually have a follow or a knock-on effect on our people? The answer seems to be yes, based on what we are seeing over here. So it's something for us to keep in mind. What about staff? We realize that staff also are coming to seek help, and this is the number of EAP or the utilization rate, and also the number of people who seek our internal psychologists. Of course, December there's a dip because it is a lull time, but you can see that once we had a round of a campaign in January to raise awareness, and then which ended in June, and then subsequently onwards, you can see a rapid increase in the utilization rate and people coming in to seek help. What is important to note that in the midst of our 13,000 staff, we do have people who belong to the high risk group. They are people who have suicide ideation, attempted suicide before, or they are trapped in a situation whereby they have vulnerable family members for which they need to care for. And these are considered a little bit of high risk colleagues, and they are working among us. So how do we approach as a company? We can approach it from a perspective whereby you need to systematically approach. It is not good to just say that, hey, these are some of the tips, these are some of the mindfulness sessions, these are some of the workshops that we have sent out for you. You need to be more systematic in approaching it and look at who are the project owners of the various initiatives. So we developed this NUS mental health framework. It's free of charge. We copyrighted it, but we want to do a lot of community capability building. So we put it free of charge. It's on our health and wellbeing website. Just go type NUS health and wellbeing on Google. You'll be in our website. Just click on resources and you'll see something like this. So what is this? It is a systematic approach to identify potential gaps now. So what you do is that you check a person's well-being, the person's capacity. So most of us are well, we have a lot of capacity. Some of us are stressed because we have projects that we need to run. We are lack of sleep, but we're still productive. There's some of us who are really in the pits and we can't see better days ahead because we are struggling with some of the situations that are acutely haunting us at this point of time. So they might need a bit of help. And some of us are on a longer journey of recovery. So at each individual phase, that person requires different type of help. So when you take a look, unfortunately, there's no animation here, but with the animation, it will look better. But what I'm trying to say is that when you take a look at this, at the three level of approach, you can see that senior leaders, you can see that they are HR, health and wellbeing, or occupational safety and health to tackle at the system infrastructure level. You can take a look at the support services and resources. What are some of the areas that we can tackle? So at the topmost level, do we actually have a committee to allocate resources and say that these are our priorities? At the middle level or the infrastructure level. So infrastructure can be hard infrastructure or policy infrastructure. So hard and soft. So at the soft infrastructure level, do we have are our managers good at setting expectations? Are there flexi work adjustment? And do we have sufficient leave support, even for those people who might have exhausted all 60 days of their hospitalization leave? Are there anything else that we can help them with? And then subsequently, is there a return to work framework that we can help the person coming back to work? Because returning to work is anxiety inducing. So without a proper case management system, the person might still go back on leave again. So it is not, you really need to think further on that. And of course, we know about the Eap Support Coaching, but you realize that you only support these two groups of people. There is our medical plan there to support them. And as you bring in more people to do this framework, you realize that it gets a little bit more complicated. And you can see that hard infrastructure actually start to come in. Do we have a quiet corner? Do we have net pots? Do we have gym to help people who are in this area? Do we have a company mental health clinic that you might want to set up as a hard infrastructure? Do we have social media campaigns to tackle our young people because they no longer read our NUS newsletter, but they are active on social media? So We also need to assess how effective are they in terms of driving and shifting the needle on mental health in the workplace or in the university. And these are some of the areas where companies and people can take a look as to how you want to measure success. We will share a little bit of how it looks like also. This is an example of what we do in NUS. You can color code it. This is what we did. We color coded it. Things that are green means that they're in place. Things that are in orange means they're still in progress of discussion and allocating resources. Things that are in blue means that we still haven't put it into our priority yet because we need to prioritize as with everything, right? For example, is there a staff disability income or income protection for our staff? It is really expensive. So you do need to actually prioritize out because people who are rendered or medically boarded out of a company, because of mental health conditions such as resistant schizophrenia. So you will realize that if you medical board the person out, that person will be rendered unemployed because which other companies will be able to employ them in the future. So disability income might be a solution to help them tide over their daily commitments, and so that they don't become a social burden even as they exit from the company. So we do have to think of it from the employee life cycle perspective and put in the various inputs to help our employee thrive. We are still not 100%, but at least we have a framework to help us understand where are the gaps that are in existence. If that framework just now was a little bit complicated, of course, you can start with this pyramid of care. You can talk about, okay, at the broadest level, all of us would have some knowledge in terms of self-care and how do we actually approach. What we are developing right now is the peer care support. So we have a peer supporters among our team members so that they can actually provide that kind of a peer care to or identify our peers who may be in distress and then signpost them to the relevant resources. Manager also require care. Manager also need to be trained to provide care because if an employee were to come to the manager and say that, hey, I have just been recently diagnosed with a mental health condition, and if the manager were to say that, sorry, I don't know how to approach this conversation, I'll refer you to HR, I think there is a missed opportunity. I think manager can have a role in terms of having a productive conversation of how we can help the employees. And then, of course, we know the EAP providers, and also we know the approach where some of our companies are providing specialized care in terms of psychiatry success and psychology success in the hospital and clinic. I want to talk a little bit about the Iot campaign because it's something that is a signature of NUS Health and Wellbeing. The question that we have in mind is it effective? And last year we did a round of campaign in 2021. We learned a lot, and this year you will see us NUS, appearing in some of the social media. And these are some of the posts that we put because it is hard to triangulate which other people in social media belong to a certain demographic are NUS students. We don't care. We just kind of blast it out to all students, whether you're NTU, SUSS, or SUTD. If you receive this, then we are successful in terms of reaching out to the students. And it's interesting that we managed to reach 4.6 million impressions, 64,000 post engagement in a 6-month period. And of course, this culminated in the No Stigma event, where our staff and our students share about their life journey. And it is so insightful. The comments that came out were amazing because it kind of like helped them feel that, hey, they are not alone in this journey of a mental health recovery or moving. Does it work? That's a question. So we did a pre and post campaign survey last year, and we saw that staff and students who consume the campaign, consume the materials of the campaign, tend to cite that they have a lesser risk of clinical depression, as shown by the pink bar that is more. We saw that it is actually more pronounced among the student body that the pink bar actually expanded post campaign. So it does work. And when we also do stigma analysis and social distancing scoring, we realize that students who have heard of the campaign have significantly lower personal stigma score. So there are more, they hold lesser bias with just the kind of education and the campaign that we had. Similarly, students who have heard of the campaign or consumed the materials of the campaign a significantly lower social distancing score, which means they are more willing to work with students with depression, whether in a group work or even as their social friends. We saw the same thing among the staff also. Staff who had consumed the materials of the campaign had significantly lower stigma, and staff who had consumed the campaign also significantly lower social distancing score, which means they're more empathetic and they're more willing to have people as part of their team, people with depression as part of their team. And lastly, they are more likely to step out, as seen by the number of ping that those people who have heard of the campaign, they say that they are more likely to step out, to seek help, and to speak to other people. So overall, campaign helps and campaign works. We just need to actually plan out in advance. And if you need some ideas or things like that, you can speak to us, and then we'll be happy to offer our viewpoints. We also want to talk a little bit about we have peer support systems, and as of now, we have more than 120 peer supporters. When you look at 120 peer supporters in the context of 13,000 staff, it's about 1%. I think it is the traditional thinking is that if you want to have a cultural shift, you need 30% penetration. If it's 30% penetration, we're talking about 4,000 staff. If it's 4,000 staff, then it is 120 is really a far cry from the 4,000 target that we want to achieve. So we are still trying to look at ways as to how we can scale up and move forward in terms of trying to build up more peer supporters. We have also developed the NUS guide for managers. So if you are HR in a certain company and you would like to see, okay, how does a mental health guide for people manager look like? You can go to, again, our website, download it, and see whether you want to adapt it. If you want to adapt it, it's free of charge. You just have to say that's, okay, adapted from NUS Health and Wellbeing, NUS guide for managers. And that's it. Because we have National Youth Council that also adopted our NUS guide for their supervisors as well, because it contains very simple verbiage for managers to actually use in their conversation with employees with mental health challenges. So what can you do now that you are consuming whatever I presented just now? Well, you can level up the mental health literacy among your team members in your company, and also for yourself. You can do that by creating a peer support system. This is something that we can do. We also offer peer support system for training companies. Only problem is that we select our clients. We don't have that many trainers. We can help you establish a little bit, but after that, we will have to say sorry, but we might have to move on with our internal focus because we have 13,000 staff to take care of. We have also NUS guide for managers that you can download free of charge. We also have the NUS framework that I kind of like shared earlier on in my presentation. You should know the benefits that support your staff and the students that you're taking care of, so that you can assign them accordingly. Okay, so this is actually for our internal people to take a look. But you can take a reference in terms of how we actually try to signpost out the materials that our staff can have access to. We also ask our staff members to reach out to us in terms of staff meeting engagement. Usually it's about 20 minutes. So usually we go on and say that, hey, you have a team meeting, you have a staff meeting, give me about 20 minutes, and I come in and share about our resources. And typically after this staff meeting engagement team training, we see a spike in the utilization of EAP and also the psychologists. Consultations and collaborations. If you have specific unique situations that require subject matter expert inputs, you can contact us, and then we are happy to have that bit of conversation. Again, we might occasionally be overwhelmed, so our replies might be very, very delayed. So I think that's the end of my slide, and I think I'm just going to pause here.
Thank you so much, Andrew. Thank you so much for holding this interesting session and for sharing these amazing initiatives with us today. Earlier, actually, we had a session on youth mental health. So now hearing from one of the world's leading universities and how you approach holistic mental well-being is really, really insightful. So we'll now go to answer some questions from our audience. So for those of you watching, go ahead and put your questions in the Q&A section, and I'll hand them over to Andrew. We just have a few more minutes left. We already have some good ones here. This is a good question that's been upvoted by quite a few people as well. It's been widely reported that students prefer not to see their school counselors, citing unprofessionalism and confidentiality issues. Why is that, and how do you prevent this from happening at NUS?
Yeah, so that's a great question. Typically, you see this happening in the MOE schools. Yeah, but they're less so among the university, not just NUS, but also in the other autonomous university like NTU, as an example, and SMU as an example. The reason why this is less applicable for the universities because our system and we hire our own internal counselors. They have a minimum of masters. We know their quality. They are very experienced. We hire them, and then we have a system of framework in terms of when do we escalate and when do we not escalate. And more importantly, we fiercely guard the confidentiality of our students. We occasionally might have requests in terms of, hey, do we have students from various faculties? Hey, I got these students whom I'm concerned about. I just want to check whether that student has come to you. We can't even answer that because we will just say that I'm sorry. We can't even say that whether this student has come to us or not. But since you have referred this student to us, let us think about it and see how we can provide and answer your anxiety. So we answer to the anxiety of the concerned faculty member who is probably referring to us. But you can see that even in our engagement, we'll say that we won't tell you whether this student has come to us. So in the context of NUS and the AUs, I'm quite confident that we are actually have a strong professionalism and confidentiality. Whatever you're seeing over here, I think is more cited among the schools that are out there. Their systems are different, so I cannot comment on that.
Totally get that. Thank you so much for that great answer. And it's always good to hear that confidentiality is taken so seriously. We have another great question here, which is, how do you help move older staff who believe in mental toughness rather than mental wellness? I think this can be, tied to age, but a lot of times we just have some individuals who really believe in that mental toughness rather than mental wellness. What are your thoughts on that?
I want to thank Jerome actually for sharing this. I see there's a psychologist from MINDEF Singapore, and what that actually means is that there might be people who have been there, done that, and have done a lot of parachute, and then say that, hey, this new generation of soldiers that are coming in at the BMT or the basic military training seems to be soft, and we need to take care of them very well. No, I want to I need to debunk this truth. Our youths are facing a harsher world in moving forward because it is really VUCA, which means that even if they were to graduate with a certain form of bachelor degree, you will realize that the world kind of like move on. You will see that I'm a doctor myself, for example, and now I'm working in the health and wellbeing industry, and my main job is not practicing and seeing patients, but it's more strategic, corporate kind of world. It kind of like illustrates to you that people do the world really moves on, and then there are different type of job opportunities, and what I learned in the past no longer applies right now compared to when you were in the industrial 3.0 or industrial 2.0, whereby you have a direct to degree program. You come up with this, you're engineer, you're forever engineer, and then you do the fixes. But right now the world is different, and the economy that's coming in, the type of knowledge-based economy that Singapore, the EDB is trying to bring into place, it requires a generalist, a person who is agile and move forward. And it is very, very unfortunate that our youth right now have to face industry 4.0, where it is very different in terms of landscape. Now, I know that I'm not answering to the context of this, but the direction that I'm sharing is that the world is really tougher on the youngsters moving forward. Jerome, if I can also signpost you to Salary Walkman. Salary Walkman has recently put up a very good post in terms of old generation and new generation. They are different. I think the context and the illustration that they portray are well done. So use that as a context to have the conversation with people who who are subscribing to this mental toughness.
Awesome. Thank you so much, Andrew, for this insight. Thank you so much for sharing all of your thoughts throughout this session with us here today. We really appreciate you joining us for the Mental Health Festival Asia. And for those of you watching, thank you so much for joining, and thank you so much for listening and for these great questions. I think that's all for now. I hope to see everybody in the next session, which is an interactive segment where you can ask Intellect's own behavioral health coaches any and all questions that you might have. So I hope to see you over there. And thank you so much, Andrew.
Thank you, everyone.